Hello, hello, my future Real Deal registered nurse rock stars. My name is Samantha, a team member with SM Nursing Reviews. Today, let's take a closer look at another one of those alternate format questions you may encounter on your NCLEX exam. Remember, we are going to break down all of these different question types and talk you through how to answer these so you won't be feeling flustered on test day. If you find yourself needing a refresher on the content within the practice question I'll walk through, definitely check out our course where we get a lot more in depth into the important content. In a previous video, we covered what was called a drag and drop rationale. We are going to walk you through the other type of drag and drop question here, drag and drop cloze. Cloze simply means fill in the blank. Drag and drop is exactly what it sounds like, dragging the correct selection to put in the sentence to fill in the blank. You might have one sentence or as many as 5, and each sentence will have at least one blank. You'll have one box with all of your possible answer choices. And your job on these questions is to sort out where these response choices go throughout all the sentences. Each word choice can only be used once, but may not be used at all, and you're free to play around with them. So keep dragging and repositioning until you're confident and then press submit. And take some deep breaths here with me. I know these alternate format questions can seem overwhelming at first, but these question types currently only make up about 30% of your exam. So the majority will be those standard multiple choice questions that you are familiar with. I like to think about the break it gives me from those traditional multiple choice questions. Now let's talk about how these are scored. 1 point for every correct selection, 0 points for your selection being incorrect. The max score on these questions is however many blanks there are to fill in. So the more points we get, the better. Just remember, if you get a selection wrong, it does not affect your overall exam score. You just don't receive a possible point for that selection to your total points on this question. So always give this your very best guess. Take one sentence at a time. The answers are right in front of you. You just need to put together the puzzle. So let's go ahead and take a look at a practice question and work through a drag and drop cloze question together. A registered nurse is caring for a client diagnosed with Bell's palsy. To assess blank, the affected cranial nerve in Bell's palsy, the nurse asks the client to blank and blank. Here are our options. Cranial nerve number 12, cranial nerve number 7, cranial nerve number 9, puff out his cheeks, say ah, smile, stick out their tongue, and move it side to side. Think this one through for a few seconds and I'll give you the answers. Go ahead and pause and then press play when you're ready. Okay, so here it is, friends. A registered nurse is caring for a client diagnosed with Bell's palsy. To assess cranial nerve number 7, the affected cranial nerve in Bell's palsy, the nurse asks the client to smile and puff out their cheeks. So while a lot of your NCLEX questions will utilize your nursing judgment and prioritization to get to the correct answer, sometimes you're going to have questions that are straight recall, like in this question. So don't neglect those straight memorization topics like cranial nerves. We love those easy points, right? And these are also great topics for flashcards. So first, you need to know which cranial nerve is affected in Bell's palsy. And that's definitely cranial nerve number 7, that facial nerve. We'll assess this cranial nerve by having the client smile, puff out their cheeks, raise their eyebrows, close their eyes tight. So there are your answers right there. With the facial nerve, I really like to think of facial expressions as the way to test it. Now, what about the rest of our answer choices? Cranial nerve number 9, the glossopharyngeal nerve, can be assessed by asking the client to say ah and watching for symmetry in the upper palate. Now for cranial nerve number 12, the hypoglossal nerve, we could ask the client to stick out their tongue, move it side to side, watching for strength and symmetry of movement, or does it move to one side or the other more? Definitely know those Roman numerals for those cranial nerves, as that's how it's going to be listed on the exam. Again, flashcards can definitely help with that. And one final point about this question type, did you notice how we had 2 responses at the end of the sentence? In a question like this, the order of the responses doesn't matter in the last 2 blanks. All right, my friends, you rocked that. Now, when you see a question formatted like this on the Real Deal exam, you won't need to stress. Deep breaths, know that you can do this, and happy studying.